Hello, this is Dr. Louise Connolly. Welcome. This presentation is entitled Pregnant and PrePolluted. It's the first in a two-part series on preconceptual counseling. It's what you need to get out before you conceive and why. Here we go. Now listen. I'm not a professional speaker. I have a lisp. And this is the first PowerPoint show that I have ever put together. I'm a doctor, and I want to have you learn this message and use it for your betterment. So please, lean in and hear me. So this is the problem I want to address. It's why our children today are seeing so much more of autism, ADHD, developmental delay, obesity, allergies, autoimmunity, asthma, etc. than the kids in 1950 did. Why is that? Well, certainly there are genetic predispositions and susceptibilities. We've looked into some of that stuff. But there's also an environmental hit, and the environmental hit starts in utero. So, where is the literature? Well, a lot of it started with a landmark environmental working group study, which found an average of 200 industrial chemicals and pollutants in the umbilical cord of U.S. just-born babies. And since that time, there have been numerous studies showing endocrine disruptors, carcinogens, neurotoxins in umbilical cords, fetal meconium, and maternal breast milk in multiple industrialized countries around the world. So much so that the American College of Obstetrics and Gynecology and the American Society for Reproductive Medicine issued an opinion statement last September saying robust scientific evidence has emerged over the past 15 years demonstrating that prenatal exposure to toxic environmental agents increases adverse reproductive health outcomes. English, please, huh? Okay. There's a lot of evidence saying that exposure of your baby to industrialized chemicals and toxins can harm your baby. Anyway, obstetricians should learn about this issue and actively advise their patients on how to avoid environmental toxins. So how many of you got that talk? I don't think many of my colleagues are that aware, which is why I'm giving this presentation both to doctors and to the patients themselves, the people, the mothers-to-be. Here's America. This is from the American College of Obstetrics and Gynecology in April of 2014. They created a new task force to investigate toxins in pregnancy. I want to investigate with you now. So what are the toxins? What are they talking about? Here's from the Agency for Toxic Substances and Disease Registry. It's a governmental agency. I think it was created in 1974. And here's their top 13 as of 2013. So let's look at them. There are some heavy metals. The arsenic, the lead, the mercury, and the cadmium from cigarette smoke and its derivatives and batteries. Then there's vinyl, number 4. There's a lot of vinyl in your home. The vinyl tiles, the shower curtain, the Venetian blinds, and more. Then there's benzene. What's that? That's a solvent. There's several solvents on here. 6 and 8 are solvents. So's 10. And another common solvent is toluene, that's a nail polish. Then there's things that we've introduced into our environment, and they persist for forever. They're called persistent organic pollutants. And then some of them we decided caused cancer, so we banned them, like DDT number 13, and we banned that in 1974. I think the PCBs were also banned in the 70s. That's number 5. And they persist. Okay, then there's the number 9, polycyclic aromatic hydrocarbons. That's car exhaust. So that's kind of a really distant view of the 85,000 different chemicals that are produced each year in the United States and what their categories are. Now, a lot of the chemicals, not the heavy metals, are stored in fat, and that becomes important, as I'll discuss later. So here are the health harms that are on the rise that are linked to these chemicals and heavy metals. You can read them for yourselves. Look at autism, 78% increase in 6 years, or obesity, 171% increase in 24 years. Okay, you get the point by now, huh? Let's move on to the solution. I'm trying. Let's see. One question that I'm often asked is, okay, well, for how long do I have to avoid these chemicals that don't seem to be harming me? Well, I'd say your lifetime, but that may be unacceptable to you, so let's move it more into your perspective. For at least a year before you conceive. And you have to focus on getting things out of your bloodstream. If you insist, make it 6 months before you conceive. Then throughout your pregnancy, and then till the end of breastfeeding, or to year 2 of life. Okay? So why beforehand? Well, you want to affect gametogenesis. What's that? That's the maturation process by which a sperm is created, gets ejaculated, and then swims out to meet Miss Egg. That takes 4 months. The egg itself has to move to the surface of the ovary, compete with other eggs to be ovulated, and that takes 4 months. So the robust health of the actual gametes, the egg and the sperm, will depend partially on how much toxin exposure is going on during gametogenesis. Of course, this also has something to say about all of these chemicals and toxins and fertility, which is what I find a lot of young women worry about. Will I be able to get pregnant? And most of them will. But you have only one chance to make a mind. So I suggest you move past that and into how can you create the best child that you're going to spend years raising and nurturing. And to go there with me now. So then, okay, you're pregnant, the placenta does not act like an armored shield, it lets things across, unfortunately, and then they go into the baby, and then when you breastfeed, you're downloading all of your lipophilic toxins. So what's a lipophilic toxin? That's a lot of these chemicals that are stored in fats. And breast milk is a fat, and you're downloading them. And so even though breastfeeding is just wonderful, you're downloading all of these wonderful things to your baby. And of course you should breastfeed. You are eliminating 20% of your toxic fat-soluble load if you breastfeed for 8 months. And I know it's an uncomfortable truth, but breast milk has been found to contain DDT, dioxins, from rocket fuel, PCBs, and flame retardants. So that's your time frame. But another way to look at the time frame is as follows. The first 9 months that your child is spending in your womb can shape the rest of that child's life. And not only that, but when that child has a child, and that child's child has a child, there is evidence that links the persistence of a lot of the toxins, a lot of the complications of the toxins down through the generations. So this is about the time, the effort you take to listen to this, as uncomfortable as it may be, to get past your fear, to get into getting them out, is well worth the effort. It's well worth a little bit of money too, because it's a legacy that goes to your child and to your child's child and to your great-great-great-grandchildren. And it's about the ADHD your child doesn't get. And for you doctors, yes, we are healers, but wouldn't you like less to heal? I would. And I don't care that somebody's not going to thank me when their kid doesn't have terrible allergies. I'm just so glad that they're spending time raising that child. And that's the best legacy all of us can give down. Don't you think? Isn't that why you went into medicine? That's why I did. Okay, let's look at genetic susceptibility in several different ways. So when these things first started appearing, they say autism, they started looking at, are there new genes being created? What are the genetic susceptibility links? And yes, indeed, there are 200 different genes, as of my speaking, that are linked to increased susceptibility to autism. But they're not new genes. They're not new chromosomal breaks. They're old genes. They're genes that we had in 1850. And yet somehow we didn't have the burden of the autistic children that we have today. So with the same genes, we've become more susceptible. And that, as I've told you before, is because of environmental toxins. One of the things I've been told by other doctors is that, oh, the autism is because all of the parents are getting a lot older. And certainly that will have an effect, and certainly there's age-related fertility problems. But another thing you really have to look at is that the longer a parent exists on this planet, the higher the toxic load of the parent. Another way to look at genetic susceptibility is to look at our genes that we have to detox, because ultimately the allostatic load, the toxic load that a woman carries at any particular moment, is going to be the net product of what she eats, drinks, breathes, and touches that transfers toxins in. And then her ability to detoxify. And women have an inherent 400-fold variability in their ability to detoxify. Here's one thing that one of my patients did, and you can do it, it's not difficult. She went to 23andMe, she paid $100 and then spit in a tube and got a whole lot of uninterpretable results. They all had RS numbers on them, there were hundreds of thousands of them, and then she's fed all of that through, in this case, a separate program developed by Genetic Genie. And she clicked on detoxification SNPs. So a SNP is a variation in your personal genetic code. And green means, in this case, that all of those variations are able to detoxify toxins extremely rapidly. A lot of green on this lady's profile. But ultimately, whether or not you have a lot of green or a lot of red, there are things that you can do to hasten your own detoxification to help your enzymes. First, by decreasing the toxins in. Secondly, by taking foods and sometimes supplements, not when you're pregnant but beforehand, that can actually aid these enzymes. Okay, the toxic hit. Different areas, major groupings in the ways that these toxins do affect infants. Oh, yes, kitty cat. I have a kitty on my lap now, you guys. Anyway, here's your areas: neurotoxicity, endocrine disruption, carcinogenicity, and immune system disruption. I'll say a few words on each. This is neurotoxins. So the big culprits in neurotoxicity are going to be the insecticides and the heavy metals. And this is made possible because the placenta is not protective armor. It sieves things across. And the fetus doesn't have a barrier that an adult has called the blood-brain barrier. That's a membrane that will keep a lot of the toxins out of the adult brain. So that the fetus and the infant's brain becomes more vulnerable. If I look at autism, this is kind of what I want to say. There are a lot of associations, but it looks like beyond a doubt there's an environmental hit in utero, and the studies revolve around looking on ultrasounds at 18 plus weeks and seeing differences in the size and shape of the brain even that early. So something's different between the normal child and the kid that's going to be autistic. Also, if you look at children who died, how sad can that be? But if you compare the brains of the normal ones and the autistic ones, there are differences in the migration of cells in both the prefrontal cortex, that's going to connect your forebrain to your frontal lobes, and in the frontal lobes themselves. And we know when that occurs. It occurs starting around 20 weeks and going on through like 7 months, 28, 30 weeks of gestation. And then there's more changes that occur later on, even in infancy. But we see the changes at this point in time, so it makes sense to have all the toxins out prior to this point of time. Here's some references and a little bit about ADHD and pesticides, many linking studies. The second area I want to talk about is endocrine disrupting chemicals. Here's a World Health Organization State of the Science of Endocrine Disrupting Chemicals in 2012. And their summary statement says that the most sensitive window of exposure to endocrine disrupting chemicals is during critical periods of development, such as fetal life. Also puberty. So what's an endocrine disruptor anyway? The doctors probably know. The patients may not. So we have a bunch of hormones, be it testosterone, estrogen, progesterone, or thyroid, or even insulin, or others. And a lot of the man-made chemicals that cross the placenta, they mimic them. They look like them. They will fit into the cells, the receptors in cells, where a hormone would fit. And they may do the same thing but more, the opposite, or do nothing. And this is going to affect how the fetus and the child develop. So, yes, I want to talk about one area of endocrine disruption that you may not think of as endocrine disruption, and that is obesity. So, many of the chemicals that man makes are stored in fat. So the fetus encounters one of these chemicals in its bloodstream. What's it going to do? It's going to get it out of the bloodstream. And what it then has to do is dilute it. So it's going to dilute it by creating more fat cells. And in the child, maybe increasing appetite, maybe doing things and chemical signals like leptin and adiponectin. But ultimately the goal is to get the toxin out of the bloodstream to a vehicle in which can be stored. So here's Felix Grun. This is obesogens. This is 2010. He coined the term. He was the first one to kind of look at this. And that's his statement there. You read it. I'll stumble over it. Since 2010, a whole lot more chemicals have been added to the list of possible obesogens. The organochlorides, these are the persistent organic pollutants. The phthalates, BPA, and an herbicide. Okay, let's move into carcinogens. Yes, an increase in childhood tumors. What else? Well, a lot of the endocrine disruptors, essentially what they do is they increase estrogen, decrease testosterone, decrease progesterone. So you're going to see that in precocious puberty and in PCOS. But then, years later, these young ladies will be at a higher risk for the cancers that are associated with too much estrogen, such as breast cancer or uterine cancer. One prime example is something called DES. It was given in the 1950s to stop preterm labor. And those little girls now, as a whole cohort, are 50 to 80. And they have a 5-fold increase in breast cancer due to a disruption that happened to them in utero. So, immune system dysfunction. Yes, this is more a third trimester phenomenon. I've had some success in some literature linking probiotic use in the third trimester and the first year of life with a decrease in these, or boosting zinc, which helps you develop your immune system. But research in this area is burgeoning as well. The culprits. What's the solution? Well, clean it up. What we eat, breathe, drink, and touch. Then maximize the out detox capacity by things that help your liver and gallbladder. Thank you. So, how do we do this? Well, first of all, you have to clean up your food. And this means not doing fast food, not doing takeout or call in and get a pizza or drinking a diet soda or something like that. It means eating real food, and one good rule is don't eat anything that your great-grandmother wouldn't recognize as food. So most of these things are in packages, okay, with multiple different things that you don't know what they are listed under ingredients. So instead, shop the periphery of the supermarket. Get the real food home. Then don't glaze it, don't overcook it, and eat it. So I love this picture. That cilantro growing out of the top, cilantro's a weed, and a lot of the really, really good herbs and foods that we can eat are really weeds. They're tough. They can survive diversity and adversity of conditions. So cilantro actually will detox the soil. So it's interesting. There was once a study called the McDonald's study that said if you go to McDonald's and have a Big Mac, and then somebody an hour later measures a whole lot of inflammatory markers that are in your blood, they're very high. But if you go to McDonald's, have a Big Mac, and then eat some broccoli, they're not as high. So here you are, nobody's perfect, you're tired, and there's some food that you know isn't great for you in your refrigerator, or you drive by a place and you get it. Okay, have some cilantro, have some broccoli. There's others too. The microgreens are great. Okay, and what do you have to buy organic? And what do you not? Well, sure, it'd be great to buy everything organic, but it gets a little pricey. So here are the Dirty Dozen. This is put out by the Environmental Working Group. This is a great website. So every year they put out what 12 fruits and vegetables have the most amount of pesticides within them. And there you go. You can see on the left you've got your apples. Apples, by the way, organic apples have something called pectin in them, and pectin tends to bind toxins. So organic apples are just really great because they don't let the toxins in. Okay, but a lot of people eat spinach and kale. Kale's got to be organic. You don't want all that antioxidant power of the kale to be sprayed with Roundup, do you? So on the other side here we have the Clean 15. So onions, avocado, corn, and sweet potato and grapefruit. You don't really have to buy those organic. Air. We live in LA. Lots of smog. You would think that keeping your windows closed would be the right thing to do, but it isn't. That's because there are so many different chemicals that are introduced into your home. Some in how it was made, especially say if it was made before 1974 and you've got some lead paint in your windowsills or something. But a lot of them are the plasticizers, your personal care products, your cleaning products, etc., etc., etc. So if you want to just do a couple of big things, one of them would be to buy a HEPA filter and put it in your bedroom. You're going to spend hopefully 8 hours there a night, and at least when you breathe, you'll get all of these little particles from all of the plastics, etc., that are in your bedroom out through the HEPA filter. It works. Here's one from Amazon. What you want is one that is big enough for your bedroom and more, and one that's quiet, that doesn't make a lot of noise, and one where you don't have to change the filter every 3 months or so. They last a good year. So here's one. This is a good one. Okay. Then you got to open your windows. Then you use your plants. They detoxify the air for you. Then dust often, because a lot of these things accumulate in dust. Then HEPA filter your vacuum. Get them out. If you're thinking of ripping up your carpets and you're not pregnant, do it. Put in hardwood floors. They're better. Water. Most of my patients don't drink tap water, but most of them just use the Brita or the Pure filters, and there's so much that those things miss. So I think that the best is a reverse osmosis filter. The Pure and the Brita carbon filters, they miss arsenic. If you remember from the Aster list, that's number 1. The other thing they miss is the dioxins that are from rocket fuel, and that's what accumulates in salmon, especially Atlantic salmon, and why you have to get the wild salmon. And also, second biggest source is beef. So you certainly don't want it in your water. So what's a good reverse osmosis filter? Well, it's one that doesn't waste very much water, and it's one that adds back in the good minerals that you need to grow a baby, like calcium or zinc or magnesium. All of those are the good ones. I bought one on Amazon. It was, I think, a little over $300, and I paid somebody to put it in. But that's an investment that I really think most women thinking of becoming pregnant should do. If I look at the areas in which we need to detoxify, I would put food and water first. The reason why is that we have 27 feet of intestines. And then if you took all the cells that line our intestines, and it's only a single cell layer that separates our internal bodies, which then will, of course, go to our bloodstream and then go through the placenta to the baby, from what's inside of our gut. It's a single cell layer. Like skin is, 20 plus cell layers thick? So if you take all the cells of your intestines and you lay them end to end, it's a football field. So there's a lot of exposure coming through what you eat and what you drink. So your food and your water are the two biggest prime targets. The other is what you touch and what you breathe. Okay. In general, punt the plastics. Anything you can get in glass, anything you can get in stainless steel is good. Watch out for the cans. The soldering, the food has to be protected from the soldering, and a whole lot of the liners of cans is bisphenol A. In general, if you look inside of a can and it's white inside there, that's usually bisphenol A. The other colors are much less likely to contain that. So if you have to buy something in a plastic container, know the recycle numbers. They're at the bottom right of the slide. The best numbers are 2, 4, and 5. 1, yes, it's okay. It's just quite porous, so don't reuse it because sediment can accumulate in those pores and create problems. Number 7 here that's other is most of the time that's BPA. So that's something you definitely do not want. So just to show you how a little thing can have a big ripple effect in somebody's life, let me tell you this personal story. I drink green tea, and I drink a lot of it. So I went through all the types of green tea because green tea is supposed to be anti-cancer and good for you and soothing, etc., 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 and eliminated a lot of them because they would have too much sugar or too many artificial sweeteners, or they'd have phosphates in it, phosphorus. Phosphorus causes you to pee out all your good metals. And then this one would give me a headache. So I settled on one, and it had ginseng in it and green tea. And I would dilute it and drink it day in and day out, and my husband would. And we both gained over a couple of years about 10 to 20 pounds, and we wrote it off to getting older and felt more sluggish. And I was preparing for this talk and looked at the recycle numbers and then at my tea, and then went, and I turned over the bottle, and on the bottom there was a number 7. Do you remember what number 7 is? BPA. Tea's an acid. Acids leach BPA out. Oh my goodness. So anyway, we punted this plastic and made no other change, and we both lost 10 pounds. Just a little ripple effect of punting the plastics. You can look at detoxing in different ways. You can just detox by area. And here you can detox by house, cleaning products. I'd simply go to Environmental Working Group and look at their safe cleaning products, throw out what you got, and buy them. Somebody will scrub a little harder, but it's a lot better for you. And it's the fact that they're volatile and whoever is cleaning is breathing them in, and that new car smell or just clean smell or the ammonia, the more it smells like that, the worse it is for you. But there are green alternatives. You can get them online. You can get them in Whole Foods or Sprouts. Teflon cookware, ditch it. Use an iron pan You need iron when you're pregnant anyway. Flame retardants. California is actually going to phase out flame retardants, make them illegal, in January of 2015. So flame retardants right now are in your couch and in the backing under your carpets. And so if you're thinking of buying a new couch, wait until next January. Dry cleaning, okay, you can do it green, you can not do it green, but take your dry cleaning, because there's a lot of solvents in dry cleaning, take the plastic off of it and hang it in your garage and let your garage detoxify it, not your bedroom closet. Paint chips, this has to do with paint that was put in before the 70s. Vinyl, we talked about vinyl before. When you look at your garden, no Roundup. It's easy enough to go through at Home Depot or wherever and get the green products there. Put some herbs out there. Grow some of that cilantro. Grow some rosemary. That's another good one too. Watercress is good. And just have a little cilantro with your dinner or breakfast. Put it in your smoothie. Detox your office. This may be the most difficult. If you're like me, you spend way too much time there. I can't change your boss for you. I'm really sorry. But stress management, your stress goes to the baby. You need to know how to de-stress. And there are so many suggestions out there, from meditation to paced breathing to whatever does it for you. Do it. Then some people, you can take just the environment at work and you can put in the plants, or you can put a HEPA filter, or you can wear gloves. These are all possible. Dust often, or make your husband do it. Anyway, here's a study. Beauty products. Yeah, I know. But this is skin, and breathing, and so I think that food and water comes first. But there are incredible products out there that are non-toxic. They just aren't usually found in your corner drugstore. The average woman in America puts 10 personal care products on every single day before she leaves for work, and each one contains 14 different chemicals. And anything that includes fragrances are patented, and they are a huge mix of different chemicals. And of course you're supposed to smell them and breathe them in, so I'd punt the fragrances too. Skip the salon. You're going to save a lot of money. Do something that makes you feel good, like get a pregnancy massage. Spend some money on yourself. But don't go into the salon and spend hours talking or getting heavy-duty treatments. What are the worst culprits if you really must go to the salon? Well, it's the nails. The tooling in the nail polish is very volatile. You can smell it, and very toxic. So buff your nails, or have them buffed. Okay? And then if you look at hair coloring products, the highlights are better than full head. That seems pretty obvious. Then there's such things as permanent and demi-permanent. I don't know why it isn't semi-permanent, but it's demi-permanent. Most colorings, what they basically do is they take some bleach, some hydrogen peroxide or something like that that's volatile and related to ammonia, and what it does is it strips the hair shaft and opens it up so it will accept the color. So that whole process is bad for you. So if you can go with the demi-permanent ones, or if you can go with just highlights, if you can do it yourself, if you can do it outdoors, you're just better off. If you must go to the salon, can you take a little HEPA filter next to you? Can you sit next to the window? if you look at hair color itself, the really dark colors are bad for you. It's the blacks or the deep brown. Often they have heavy metals in them. I've seen it. I've had somebody come in that dyes her hair and measured her whole blood lead level before and 2 days after she had her hair done at the salon, and watched it go up. Even though her hairdresser said, "Oh, I don't know. I never heard something like that." It just tends to be true. References? Go to Skin Deep. Look things up. Go online. I have another personal story to tell you here. I have rosacea, and my skin itches, and I have a lot of little allergy things. And yes, I was going into the mall, which I really dislike, and going in and buying some expensive mall brand, and using it as makeup to look a little younger as I get older. And all of these brands, they would make my eyes water, and they'd make my rosacea come out. So actually, one of my patients in her 20s turned me on to a number of websites that I could turn you on to, where I went in and got good minerals, and yes, they'll go in through the skin, and my face is so much better. It doesn't itch. I feel better. Yeah, it was just a little bit more expensive than those highly touted brands you can get in the malls. How pervasive are these toxins? Well, this kind of irritates me. So any doctor has drug reps come in, and the drug reps show what's supposed to be a superior brand, and these are two FDA-approved superior brands of prenatal vitamins that you need a prescription for, and they cost more than Trader Joe's. And these brands have antifreeze in them. Yeah, that's propylene glycol. What's it doing in there? And cyanide? Okay, that's in the B12. So B12 is called cobalamin. And cyanocobalamin is cyanide plus cobalamin. It's the cheapest form of B12. But what's it doing in a prenatal vitamin? I mean, really. And do you really care what the color of your prenatal is? Well, it's got aluminum. Aluminum's a bad metal. Precipitated petroleum-based dyes. Ugh. Excuse me. Here I have some resources for you. This one's great. This is going to teach you step by step how to do a home detox, how to choose your personal care products. And it's free. So you go to healthychild.org, you put pregnancy ebook into the search, and it's 46 pages, and just download it. And then, yes, it's worth the time to do it. Really? Didn't I convince you already? The second one here is the Environmental Working Group, a great resource. And so you go there, and then there are all these little portrait rectangles like I've shown here. And you go, okay, today I'm going to tell the maid she's got to spend a little extra time and use better products. I went to EWG's Guide to Healthy Cleaning, and I bought them for her. Okay, so then you go to the shopper's guides. Then you go to the one that does the Skin Deep products. Then you go to the one for suntan oils. But there are many, many of them, and you just do what you think is appropriate for you. If you're the maid, and often I'm the maid too, it's even more important. If you skip the salon and you want to hire a maid once a week, all the better. Anyway, I want to close with this. Whatever befalls the earth befalls the sons of earth. Man did not weave the web of life. He is merely a strand in it. And whatever he does to the web, he does to himself. and to his progeny. Thank you so much for your attention. Bye now.